Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I want to talk about nursing school versus actually working as a nurse. So there are many differences between working as an actual nurse and being like a nursing student in nursing school. And one of the things that I can think of is really the stress. Like with both, you're going to have stress, but the stress is really different. Like with nursing school, you stress about grades. You have to get a certain grade to stay in the program. You have to pass these mid-curricular exit exams. You have to manage and juggle everything and get through it. Now, with being a nurse, you're going to have stress, but it's a different type of stress. And now you have all this responsibility and accountability on you. In nursing school, as a nursing student, you really didn't. Like, it was on your preceptor and you were there learning, but you didn't have that on you. So you have to take care of these people. Their lives are in your hands. So their stress, they are both nursing school and working as a nurse, but it's different. Next are the nursing care plans. Now, the nursing care plans in nursing school are ferocious. Like, I remember having to go the night before to collect all my information on my patient, then coming home and doing the care plan. And it would take me like 4 to 6 hours because you would have to develop all these diagnoses, you would have to do these interventions, look at the labs, and then you would have to go and write out to your professor why you picked that. Like, why you picked this certain diagnosis based on what this patient has. And it was very complicated, very in-depth. And those are really designed to get you to think as a nurse. Even though I hated doing them, looking back, I'm like, yeah, they did help me. Now, whenever you actually work as a nurse, those care plans are going to go a lot faster because you're going to be seeing the same patients usually day in and day out. And you can usually see a patient coming down the hall, take a look at them and say, oh, fluid volume deficit. And you're just gonna know, and you're gonna know those interventions to go along with that care plan. And the care plans are a lot more streamlined depending on whatever system you have. You check boxes, you mark it off, you're updating them constantly because throughout that 12-hour shift, that patient's changing, so you're gonna have to change your diagnosis, your interventions, goals, things like that. So with both, you have care plans, but they're different. Another thing is the lingo. Now, nursing students and nurses, they really speak two different languages. And what I mean by that is that in nursing school, you're taught the proper terms to call things and how to label things. But whenever you get around a real nurse who has worked for a while and you start hearing them talk, they use these special lingo, these words that you may not understand. Like, you walk into a floor as a nursing student and you hear the chatter going on around you, and it's almost like they're talking a different language because they're using abbreviated terms to communicate quickly, and people around them knows what they're talking about. For instance, I remember whenever I was on the floor as a nursing student with another nurse and we were about to go see a patient, and the nurse turned to me and she was like, hey, go get us an IS out of the clean hold. And I was like, okay. So I'm turning around to go get an IS, and I'm like, what in the world is an IS? And I'm like looking down the hall on my way to the clean hold, and I'm like, man, is there anyone there that can help me with this? And I see a nursing aide come out, and I'm like, hey, do you know what an IS is? And they're like, yeah, an incentive spirometer. I'll help you go get one. So I was like, oh, thank heavens, you know, they're going to help me get that. And that's just how nurses are. We just talk in lingo. Like, for instance, you may be talking to a nurse and they're like, yeah, I had a patient who was NPO, they're 18 gauge blue, they needed a stat chest x-ray along with a BMP, a CBC, and their tropes were elevated. And, you know, some people might look at and be like, what was that? Another difference is that nursing changes so rapidly. And what I mean by that is that some of the things that you're learning in nursing school, like the skills and some of the theory, will actually be a little bit different whenever you start practicing as a real nurse. Because in the real world of nursing, they want the most current guidelines and evidence-based practice. So you may be doing this certain skill this way in nursing school, but once you get on the real job, it'll be a little bit different based on, you know, some tweaks to how it should be done to protect the patient better. For instance, I remember in nursing school, it was absolutely drilled in our heads how to do a sterile wet to dry dressing change, and we would have to perform it and do it perfectly. Whenever I became a real nurse, we really didn't do it. And I had recently taken a wound care continuing education class, and it showed that wet to dry dressing changes are not the best practice today because we have so many other products and things available to use for a patient. Another difference is that nursing school is really broad, whereas being a nurse is really narrow. And what I mean by that is that nursing school is broad in that you learn about every specialty about nursing. You're going to learn about OB, peds, psych, geriatrics, med surg, critical care, and it's so much material, and they can only really hit the highlights, because if they taught you all the nitty-gritty about all those specialties, you would be in nursing school for like a decade. Now, being a nurse is like really narrow, because you go, you select, you get this position, and you're going to learn the nitty-gritty, the ins and outs, and you're going to become an expert on that specific field that you're in. So if you go and work in oncology, you're going to do a brain dump about OB, because you know everything about oncology and how it works. So to me, being a nurse is so much better than actually being a nursing student in nursing school. So if you are in nursing school right now, you're a student, hang in there. I promise it gets a lot better, because nursing school is like 90% academic theory. You're studying in the classroom, you're listening, you're learning, and only like really 10% skill. And a lot of nurses have the same quality. The ones I've worked around, we love to be like hands-on, working with our hands, being busy, and we don't like to sit down and have to listen to lectures and just be still. And being a nurse, you get to work with your hands, so it's a lot more of that. It's like flipped, but you're applying that theory and you're like meshing the two together, so it's like a really good combination. And another thing, which is like really the most obvious thing, is that you don't have homework as a nurse, and you don't have to take exams and be studying for those all the time. Now granted, whenever you get hired on as a nurse, you may have to take some like tests, like dosage and calculations tests whenever you get first hired on, but it usually stops with that unless you want to go on and get certified, things like that. So it's completely different than with nursing school, because in nursing school, you're always studying for an exam. You're completing a care plan, going to clinicals, and there's always something to be doing. And if you're not doing something, you're like, okay, what am I missing? Because I can be doing something. There's always something going on 24/7 that you're prepping for and doing. Okay, so those are some differences between nursing school and working as a nurse. Thank you so much for watching, and don't forget to subscribe to our channel for more videos.